Pattaya City Expats Club is a non-profit social organisation and our speakers are volunteers. The club as such assumes no responsibility or liability for the professional reputation of or the quality of services provided by the speaker today.
Anyway, it gives me great pleasure to introduce Dr. Arya, who is from Bangkok Hospital Pattaya. She is a general practitioner and a travel medicine expert. So you guys that have travelled a long way, or intended to travel a long way back, maybe you should talk to Dr. Arya about the best medication for your journey. She's a graduate of Chulalongkorn University and has a fellowship in clinical dermatology from the Institute of Dermatology in Bangkok. She's currently at the Health Promotion Centre of Bangkok Hospital Pattaya, and what her presentation is discussing today is, I'm sure, a subject dear to our hearts. As one gets older, one tends to start focusing not on the latest soap opera or the latest ball games or whatever, but you start comparing notes about your latest ailments. Dr. Arya will tell us what you need to get checked, when you need to check it, and why you have to check it. So please welcome Dr. Arya.
Okay, good morning. I'm truly honored to be here with you today. And thank you for inviting me for sharing this moment. Okay, this one? Today, I will talk about the health test and screening everyone should get. Because of according to the UN standard, a rapidly increase in the lifespan over the past few decades, the population age 60 and older will increase in every country. The rise of chronic non-communicable disease, such as heart disease, cancer, and diabetes, reflect the change in lifestyle and diet as well as aging. So for the older people already suffering from one of the chronic or infectious disease are vulnerable to infectious disease. For example, for heart disease and influenza are well-known comorbid risk factors that have less health outcome for the older people. So stress is an issue facing in many individuals. Time and time again, we see people feeling overwhelmed because of the pressure that they face as a part of modern life. So, what are some common causes of stress in the modern life? Also, like a technology here is wonderful. So we connect the people far away in a different time zone, and we have insight into that life simply by sitting behind the smartphone. Actually, in the past, we try to do too much. The pressure to maintain the image of perfection is really exhausting, and what many of us want to. And this is not like you. It's helpful to ask yourself you are heading toward the burnout and what impact is on your quality of life. And this one, stress is an inevitable part of your busy and your modern life. Unfortunately, most of us are time poor. Stress release mechanisms frequently tend to be poor, like drinking alcohol, heavy smoking, and having a shot of caffeine and coffee and sugar and eating a fatty food. And family factors increase risk of many diseases, for example, heart disease, a stroke, and diabetes. And also, family history of cancer also increase risk of getting colon cancer, prostate, liver, breast, and other many cancers. But these days, as one in the vaccines and vaccination research have the potential to prevent many illnesses, and also advancement in medical technology allow physicians for better detect, diagnose, and treat many illnesses as early as possible. And this is a good thing and give the patient a better chance for getting well again. So, and this one for the health promotions like exercise and healthy diets, and about health checkup for early. This is the purpose for early detections to effective management of risk factors and also prevent and control the disease burden. Okay, so I recommend anyone who are aged above 45 years, you should get the blood check and urine exam, and about the stool examinations, and also heart health check and cancer screening if you have a high risk. So what we need to check about blood test: 1 for diabetes, for lipid screen like cholesterol, anemia, leukemia by complete blood count, and also hepatitis and liver disease, and also kidney disorder and gout. For the heart health check, because of the heart disease is the number one killer in the world, and approximately about 1/3 of all deaths around the world are a result of heart disease and stroke.
So many things.
Why heart disease is silent killer? And here's what you need to know about this. Heart disease doesn't produce any symptoms. You never have any warning signs and that you develop the heart problems, such as chest pain or shortness of breath. So half of people have the heart attack die before getting to the hospital. That's why you need to check that you are at risk. Many risk factors of heart disease are also silent. If you do not check them, you might not know. There's several risk factors. Some you can change, but some you cannot change. And you cannot change your age, right? Risk factor of heart disease is increasing significantly after the age of 45. And you cannot change your family history. So the more family members having heart disease, the closer they are related to you, your risk is increased. So the family history is the potent risk factor. If you have 1 degree of family member having heart attack under age 55, so you increase risk by 33%. If 2 relatives having heart attack, increase risk 15%. And this one is about risk factor you can change: high blood pressure, high cholesterol, high blood sugar level, and kidney disease. And also lifestyle risk factors are very important, such as smoking, overweight, or high salt or high fat diets. Especially cigarette is a terrible risk factor for heart disease. So quitting is the most important step to reduce that risk. So we recommend to getting heart health check if you are above 45, and also recommend anybody under 45. Even if you have only 1 risk factor, you should go to see the doctor to check about heart risk. Actually, for the heart check, is usually done by GP or cardiologist as heart disease specialist. And this is what you need to know about the number to your blood pressure, because high blood pressure increases risk of heart disease. So the guideline recommend the blood pressure should consistently less than 140 over 90 mm mercury. And to reduce your lifetime of heart disease, your total cholesterol should be less than 4 or less than 200 milligram per deciliter, because of it's a different use. Actually in Thai we use milligram per deciliter, but maybe in Europe or America you use millimole per liter, right? And LDL or bad cholesterol should be less than 2.5 or less than 130. If low, you have low risk for the heart disease. For some people, high cholesterol may come from genetics. Whatever how well they eat, how much they exercise, they was the target level just simply because your body built too much cholesterol. So the guideline recommend you to start medications in people who are not at the target level despite their healthy diet and regular exercise. And this is supported by strong scientific evidence. And this is what we check at the hospital. Okay, the first one. This one we call ECG or electrocardiogram. And this machine record your heart rhythm to check about you have arrhythmia or not, and show if there are any sign of acute heart attack. And this one we call exercise or treadmill spread test. Okay. And so you walk and run on the treadmill. That makes your heart work progressively faster and harder. And this test can reveal the problem with your blood flow within your heart and need to determine your likelihood to having heart attack. And this one is a new machine we call CT calcium score. This is non-invasive CT scan for heart. We use spatial X-ray equipment to produce the picture of coronary arteries to measure about the amount of calcium deposit in the wall of arteries that supply your heart muscles. And the next is about, this is quite a big problem because of there's a lot of cancer occur these days. For cancer screening, you can check by blood test for tumor marker for liver cancer, pancreatic cancer, and prostate cancer in men. And stool examination is a tool to check colon cancer at the early stage. And also ultrasound. This is non-invasive and reasonable price to check is there any abnormality inside the abdomen, like this organ, liver, gallbladder, spleen, pancreas, kidney and bladder, uterus and ovary in women, and prostate in male. So this is what we recommend to get screened. This is because this is a top 8 cancer if you should get screened. But this is full of cancer as a routine screening for everyone, like colon cancer, prostate in men, breast and cervical cancer in women. But this is not routine screening in general populations. We need to get screened for the high-risk population if you are at risk. Lung cancer, liver cancer, pancreas and stomach cancer. This is a top 10 cancer. It occurred in last year, 2018. The number 1 is still lung cancer. The number 2 is breast cancer in women. Number 3, colon cancer. Okay, I will start with colon cancer. Actually, this is no obvious sign or symptom that may develop. Actually, it's preventable and highly curable if detected in early stage. The aim of screening are 1. early detection by stool exam or fecal or occult blood test, and prevention test by colonoscopy to find out like is there any polyps or early stage of cancer. But CEA, this is tumor marker for colon cancer. We not recommend for screening test because it's low sensitivity and specificity. So we recommend everybody who has no risk should get screened at age 50 until 75, or at the age 40 in people who are at higher risk of getting cancer, such as your family history diagnosed colon cancer. Then you should get screened every 5 years if you are at high risk. And this one, this is colonoscopy. Colonoscopy is like a camera, it's a flexible tube. We put through the bottom and up into the bowel to see any sign of cancer or polyps. And this one can like to cut and burn off. After remove the polyps you will send to the specialist in the laboratory to see inside is there any sign of cancer cell in the polyps. If there like cancer cells, you may need to get further treatment. Then your specialist will be able to advise you on this. But if no polyp or no sign of cancer, you may need to get screened colonoscope every 10 years. Or you can get screened by stool exam or fecal blood test every year. The next is about prostate cancer. And this one is the most common cancer in men. Actually, it's generally slow growing and treatable in early stage. In the most cases, the symptoms are not apparent in early stage of disease, and maybe it's different for each man, depend on its size and location. The cancer can press the urethra and inhibit the flow of urine. But these are signs and symptoms of prostate cancer in the advanced stage, like pain or difficulty on urination, or more frequent to go to urinate at night after you go to bed, or to decrease flow or velocity of urine stream, blood in urine or in the semen, or difficulty getting an erections or erectile dysfunctions, or painful ejaculations, or even pain in the hips or spine if the prostate cancer may spread to the bone. So, as a result, routine screening in men are very important. So we begin at age 50. So earlier, if you have family history stated, to get screened, we get screened by digital rectal exam or PSA blood test. So actually, PSA we use to screen in men without symptoms. If PSA lower than 4, you may need early annual screening. But if higher than 4, it may be sign of prostate cancer, urinary tract infections, or like benign prostate gland hyperplasia. It's benign condition of prostate. It's bigger when you are getting older, and you may need to consult specialists for the best advice. The next is about breast cancer. Actually, we recommend all women should undergo regular screening by mammogram annually to detect breast cancer at before the symptoms occur. So, all women aged 45 to 54 years without any risk factor, you should get screened every year. Or women aged above 55 or older, you can switch to mammogram every 2 years, or you can continue screening every year if you wish to do so. But in the high-risk populations, like you have this one. Genetic factor, like mutation of BRCA1 and 2, you should get screened earlier at age 30. If you have family member has a breast cancer and they are under age 50 or has breast cancer before menopause, you should get screened 10 years before the age of diagnosis in the family. Then you should get screened every year. Yes, it's very hard, difficult to understand. This is for example. So if your family member, like mother, diagnosed breast cancer at age 45, so her daughter should get start screening at age 35, like 10 years before the age of diagnosis in family. And also family factor, as I let you know, also ovarian cancer, you should get screened earlier, or hormonal factor if you have history of early menarche before age 12, or had very late menopause after 55 years old, or use very long contraceptive pills or hormonal treatment more than 5 years, you are at risk. And also, you had history of radiation therapy to the chest, like history of Hodgkin lymphoma, or it's about lung cancer. You had history of radiation before, or also breast implant by silicone and filler. And this is a cervical cancer. Actually, this is one of the most preventable cancer and often be cured if it found in early. The number of deaths of cervical cancer has been decreased since the implementation of widespread screening tests. So we get screened by pap smear or cytology to see signs of cancer, or HPV testing to see high-risk HPV virus strain. So I recommend to get screened with pap smear alone in the women age 21 to 29, and then should get screened every 3 years. But in the women age 30 to 65, you should get screened. But actually, we have 3 choices. Okay, like if you need only pap smear, you should get screened every 3 years. Or if you need screen with HPV test every 5 years, or co-testing pap smear and HPV every 5 years. And if you are at high risk, so you should follow the women doctor or gynecologist advice. And if you are over 65 years of age, but in the past, you get screening every year for 10 years, but there's no evidence of cervical cancer found in last 20 years, you should stop screening. But in women who have history of surgical removal of uterus or cervix, but you don't have history of cervical cancer, you should also stop screening. Okay, for the high-risk screening, lung cancer. In the both sex of male and female, lung cancer is the most commonly diagnosed cancer and leading the most common cause of cancer death. As you know, smoking is including intensity and duration of smoking increased risk of lung cancer. But surprisingly, there is a high incidence rate of lung cancer in Chinese women. But as you know, they never smoke cigarettes. It reflects that they increase exposure to smoke from burning charcoal or for heating and cooking. And this is what you need to know about lung cancer screening. Actually, there's no routine screening in general populations. We recommend annual screening with low-dose CT. For high-risk lung cancer, we help to find any abnormality or lung cancer at early stage, which is easier to treat. For the high-risk populations, adult age 55 years to 74 years, who is currently smoke or have quit within past 15 years, and who has at least 30 past years of smoking history. You might not understand about pack years. Okay, so pack year history is a number of packs you smoke per day multiplied number of years you smoke. Okay, 1 pack is equal to 20 cigarettes. For example, if you smoke 1 pack per day for 10 years, is equal to 10 packs a year. If you smoke 10 cigarettes per day, it's about half pack for 10 years. It's equal to 5 packs a year, okay? And if you are at high risk, or you with a family member that diagnosed lung cancer, or you have previously exposed radiation therapy of the lungs, you should get a screening earlier at age 50. And this one is about things you need to know about low-dose CT. Actually, this one is produce the high-quality image to detect many abnormalities while using extremely low level of radiations. It's about it's up to 90% less ionizing radiations than conventional CT of the chest wall, and no need to get contrast injection. For the liver cancer, especially in Thailand, this is the most cancer in male. And risk factors are cirrhosis from heavy alcohol drinking or viral hepatitis B and C, which may exacerbate the mutation of cancer genes. People chronically infected with hepatitis B and C is about 100 times more likely to develop liver cancer because the virus directly attacks the liver and is attacked over time. It leads to increasing the liver damage, cirrhosis or a scarring of the liver, and ultimately liver cancer. And so people who are at high risk, like cirrhosis and chronic hepatitis B and C infections, and with family member diagnosed liver cancer, you should get screened every 6 months by ultrasound of upper abdomen and AFP. This is a marker for liver cancer. Or you may need to request to check viral hepatitis B and C in the blood. And this one is also very important because it's silent. And actually, this is the most common cause of death and low this is low survival rates in the populations. At this time, actually, there's no routine screening in the general populations. For individuals without risk factor, you should not consider to get pancreas surveillance. But in the highest populations, as like strong family history of pancreatic cancer, you should get start screening by CT or MRI scan and also CA-99 at age 50. So, but if it caught it early, pancreatic cancer is treatable with surgery, but it's curable. So it's important for early detection. Actually, this one is also the silent killer because it grows slowly and spread undetected. And like many cancers, it presents few warning signs. The symptoms often same as other cancers, like such as diabetes, and it may include pain in abdomen or jaundice like yellow eyes or yellow skin or loss of body weight unintentionally. Among all forms of cancer, pancreatic cancer survival rate is lowest, but you might be able to reduce risk by primary prevention like stop smoking, healthy diet, and regular exercise. Okay, the last one was cancer, stomach cancer. But actually, stomach cancer rates these days varies among different geographic regions. The half of total stomach cancer patients live in East Asia, especially in China, Japan, and South Korea. And this one is the 5th most common cancer, but it's the 1st most common cause of cancer death in the world. And actually, it remains very difficult to cure because most patients present with the advanced stage. It's actually the early stage of cancer present no symptoms. However, there's no routine screening for stomach cancer these days. But we recommend to get screened in people aged 50 or older than this, and with new onset of dyspepsia. Dyspepsia is about the sign of discomfortable or sense of fullness in the abdomen, or family member diagnosed stomach cancers, or whoever have alarm signs such as like difficulty swallowing or dysphagia, or jaundice, yellow eyes or yellow skin, and palpable mass in the abdomen or palpable lymph node. You should get screened. And this is indication for endoscopy or esophageal duodenoscopy. It is like a camera and flexible tube to see inside the stomach, to see sign of cancer or ulcer in the stomach. Okay, after we finish the exam, so all examination will be reviewed by our doctors, and you can consult and get physical exam by the doctor. Then we will make a conclusion and give you the medical reports. So this is the vaccine. So we can't stop the flu, right? But the vaccine against H1N1 has been extremely effective this year. It can help, and it's still a good idea to get the flu shot. Actually, every year, many people contact vaccine preventable infectious disease. So we recommend to get a vaccine in adult age 65 and older for shingles, pneumonia, and influenza. We can protect you against. For the flu vaccine, I recommend to get every year. And about pneumococcal vaccine, you may need to discuss with your doctor whether you should get. Actually, but I strongly recommend to get, but you need to discuss with your doctor first. And about tetanus and diphtheria vaccine, if you live in Thailand, I recommend to get every 10 years. And shingles vaccine, but you need to discuss with your doctor because there are two different vaccines available these days. In Thailand, we have only Sostal, this one is a lymph vaccine, but in your country, in Europe and in America, it's Chintric. I'm not sure you have heard about this or not. And this one is a new vaccine, just US FDA approved in 2017. And this is the most effective vaccine against shingles. But you may need to consult your doctor about the type of vaccine first. And this one, what is it like? And this day, this is what the role of medicine. It's a personalized medicine. It's the tailored for individuals, and will give you the suitable and explain what you have and explain what you need to get checked. And about like we will try as a private hospital, yes, we try a quality one-stop service. So longevity is with well-being is the modern medicine big challenge. So lifestyle modification can be used to treat a range of disease, including obesity, and target behavioral change like nutrition, physical activities, and weight reduction, and smoking cessations is preferred to treatment and prevention of many diseases. Okay, so and now we are like a society. So I think everybody needs to hear you look good for your age, right? So on to the page of 2030 Agenda for Sustainable Development that no one will be left behind. Health promotion plays a particular role in early detection and effective management of risk factors such as hypertension and other important conditions such as diabetes. And that will greatly complicate the treatment of heart disease and can be inexpensive. And this is the most effective way to controlling the disease burden. Thank you. Yes, please.
Two things. First of all, I spent years teaching public speaking, and you have done an excellent job. You are well organized, which is one of the #1 things to keep your audience interested. Your organizational pattern was excellent. The second thing you did very well was your visual aids were perfect. They were visual aids. They weren't all the information. You were the information, and you did a great job at that. And choosing your visual aids kept us aware of what you were talking about, but we didn't get hung up on those. We listened to you, so very nice job.
Thank you. Thank you.
My question for you is this. Do you know anything about or heard about, because I've read about, oxygenized cholesterol? Am I saying that right?
Yes.
Okay, I'm going to sit down, and if you could tell us anything about well, you say it, I can't say it.
So the question is about, you need to know about cholesterol.
Oxygenized.
Oxygenized or saturated fat. Yes. Okay, so actually this is called trans fat, right? Okay, so we recommend to avoid trans fat. Please see about the label whatever you eat. Please reduce trans fat as low as possible to prevent further risk of heart disease and stroke. Okay?
And is there medication now?
Also the medication? No, actually no, it's unavailable this day. But we reduce LDL cholesterol in the blood. Okay? But we cannot reduce trans fat from the foods you intake. Any questions?
Yes.
Yeah, I had questions, a couple relating to prostate. So I saw your numbers. If it's 4 or less, then screening not recommended or needed. And I saw 4 through 10. So I've also read, let's say your prostate reading, your PSA, as we age, don't our normal PSAs tend to rise a little bit, where we might have 5, 6,
Yes,
and
correct.
certainly don't need a biopsy if we have a 5 or a 6 PSA reading as we get 60, 70 years old. Is that true?
Yes, correct. Okay, so if it PSA is in between 4 to 10 and increasing by age, right? If it more than 10, it's indication for to get prostate biopsy. If it in between 4 to 10, you choose to discuss with our specialist, you have risk or not. So it's like there are two ways. One, wait and see, follow up every 3 months. 2, you should get prostate biopsy earlier to see any sign of prostate cancer.
Because I've also read or heard that the biopsy itself is quite intrusive and can cause many problems. So
Yes.
if your PSA reading is between 4 and 10, would you still, and it doesn't seem to be rising, maybe it's staying 5, 6, right in there, you keep checking and it doesn't seem to be rising, would you say don't get a biopsy because that can cause problems in itself?
Yes, but there's no 100% true about PSA. But you need to discuss about the risk and benefit. Okay, so it's a role for biopsy is for as early detections, like cancer at early stage. Okay, but we need to discuss about the benefit and risk for biopsy. If you can accept the risk of biopsy, yes, you should select PSA. If you cannot accept the risk, if you cannot accept the risk of prostate cancer, like you should get biopsy.
Yeah. Also, I think you mentioned, you were talking about an abdomen screening. Was that ultrasound?
Yes.
And I saw prostate in there. So
Yes.
is an ultrasound examination of prostate an effective way to screen for prostate cancer?
Actually, for the prostate cancer, for the size of prostate, it bigger. It doesn't mean you're getting prostate cancer. It may be benign condition. It's not cancer, but it's getting bigger for the age. So the ultrasound just give more detail about prostate size. It may form benign conditions, but it may form cancer conditions. If as well you have risk and rising of PSA level, this is an indication for biopsy. But we can see only size. We cannot tell you about you have cancer risk or not.
Thank you.
I have one question. You didn't sort of mention anything about skin cancer, which is quite, in this hemisphere, prevalent all the
Yes.
time, and is a big worry.
Yes.
Can you say a little bit about that?
Okay, skin cancer actually is not actually it's not not common in Thai, but it's most common in Europeans, okay, in Europe and Americans. Okay, so sign of cancer that we have two types of cancer. One is about non-melanoma skin cancer, like squamous cell carcinoma or BCC or basal cell carcinoma, and very kind of like various type of cancer. But if you have the mole or something like a tumor rising on the skin, or when you touch, it feels like it laugh. Okay, so you should get screened. Okay, this is like cancer, and prevention is better than treatment, right? So you should get like sun protection as much as you can, and now to get screening. Okay, so maybe you may need to request for full body examinations to see any sign of cancer. If there is like a precancerous lesions or like actinic keratosis, this is a medical term. You should get prevention by liquid nitrogen or biopsy to see any is this type of cancer to protection before getting advanced disease.
I'm just curious as to why the medical profession uses the age 75 as the magic age of why we don't have to worry about being tested anymore.
Because it depends on the life expectancy. Okay, if anybody expect to live longer than 10 years, yeah, sure, you should get checked. Yes, sure. But anybody older than 75, that has a lot of comorbidities, like many diseases. Okay, if you expect to live less than 10, I think no need to worry. Okay, please focus about the current disease you have.
Doctor, on your left, doctor. On your left.
ค่ะ.
Hi, my name's John. Just for the gentleman in the blue shirt over there who asked about prostate cancer, I'd like to briefly share my experience of diagnosis last year, which was last May. I got a PSA reading of 7, which was repeated after 1 month, again 7. I went along to the local hospital the same day. They gave me 3 MRI scans. So I went into an MRI machine and they put an injection into my bloodstream to show a certain colour, and that showed there was a shadow on the prostate.
Yes.
It wasn't going to be cancer necessarily, it could be a benign tumour, but there was something that needed investigation. So then the next step was the biopsy. Now I won't pretend the biopsy was a barrel of laughs. They get a long needle and they stuck it up through my perineum. I had a spinal injection here, spinal anaesthetics. I was lying there, I was fully conscious, I had my headphones on, I was listening to Jimi Hendrix while they did it. 20 minutes, they had taken 10, 20 little samples out of my prostate. Click, 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 put them in 20 little bottles, sent them off, and it came back that I had got a certain grade of prostate cancer, early stage, localized, treatable through surgery, and I'm now fine. I'm now 100% okay. So don't be scared of the biopsy. I think that biopsy injection I had, I think there was something like a 1 in 10,000 chance of anything going wrong. It left me a little bit sore between the legs for a week and a half. After that, I was okay. Thanks.
Doctor, I could be wrong, okay, but I've read many times that Australia has the highest rate of skin cancer, not Europe.
Yes. It just means like so I think in the Australia, and it's depends on about the genetics and about how long you get close to the sun. Okay, so especially you should see the sign of cancer. I'm not sure you know about because various type of cancer is related to sun damage of skin. Okay, like as let you know about non-melanoma and melanoma. Actually, melanoma is very easy to see. Okay, because it's a bright color. But some melanoma has no color. actually it's the same color as skin, as normal skin. But for the non-melanoma skin cancer, okay, actually it's often like found in the upper chest. It's a sun-exposed area, in the scalp or head, and on the back of neck, okay, and any side like forearms and legs, okay. So actually it's quite very hard for us to see. Actually everything maybe like from inflammation of skin we call eczema, but actually this is not eczema. Especially when eczema cannot heal, like it's getting worse after you take topical steroid. Please notice that this is a sign of skin cancer or squamous cell carcinoma or precancerous lesions. You can need to get checked.
Are there any more questions, please?
Yeah, one more. No. Yeah, man.
Hello, Doctor. I'm glad you cleared that, straightened that out about the age of 74, because my friend Will here, he's an old guy and he was kind of hanging in there. He said, I don't know if I should be here or not. But when you talk about skin cancer, I've been to 3 dermatologists, everything, and it seemed like on my arms, my skin, I bruise real easy. I don't know where it comes from. But I don't know, maybe you can massage my arms later or something and help me.
Actually, this is a sign of like common in elderly people. It's like easy bruise. Is it like red sign? Actually, it's like a fracture of superficial red cells. Actually, it's not sign of cancer.
I think that's a no.
It's a normal. It's a normal in.
That's normal.
Yes, it's normal in at your
okay.
age.
See, there's something normal about you, Ron,
Friend Will here, you know. Yeah.
despite the rumors. First, I want to really thank you for an excellent talk. And I really want to acknowledge Tanya because she's our liaison at the Bangkok Matai Hospital. She always works with me on the topics and we agree on the topic that we think everybody will like and get value from. And also I just want to say as an Australian, every year I get my skin spots checked and I get stuff frozen off, and I really recommend that to all Australians. Get an annual skin check and sunspots frozen off.
Here, here.
Thanks again.
Doctor, thank you so much for an excellent presentation. And if you'd like to join me in the centre of the stage here at the front, we want to take this, give you the certificate of our thanks for your presentation and take a photograph for posterity.